The state of Oregon, the criteria is that somebody does pose an imminent risk to themselves or to other people.
Dr. James Coved is co-medical director of the Psychiatric Emergency Services Division at the Unity Center for Behavioral Health. When assessing patients brought in for a mental health evaluation, Coved may recommend treatment or care, but if they refuse, he must check off a detailed assessment before issuing a notification of mental illness or involuntary hold for treatment.
And the bar is quite high, and so we are looking for, we are sort of held to a standard of looking for very high level of risk that a person might be at in order to seek involuntary treatment.
In Marcus Tate's case, we know police officers brought him to a hospital the night before the MAX train hostage situation after an apparent mental health crisis. He was held overnight. We don't know the details of any evaluation he received, but he was released the next morning.
People's circumstances change really quickly, and there's certain things that people might have done in the past that they wouldn't necessarily do in the future. It's a really challenging assessment.
In Oregon, if a physician does believe a patient meets all criteria for an involuntary hold, that assessment is reviewed by the county's involuntary commitment process before being reviewed by a judge before civil commitment may be approved.
There are times when we absolutely recognize that there's illness that's present, and we still are not able to provide treatment for people.
Coved said the current system has gaps and could leave vulnerability for risk, but it shows the balance between prioritizing civil liberties and prioritizing medical treatment.
Oregon, as a state, has chosen a relatively high bar, which allows people to live independently and to maintain their rights, and at the same time can be a real challenge when people are facing a high level of mental illness.